Assalamu alaikum. Today we'll be discussing the anatomy of external air. The air is composed of three parts. The external air, including this canal, then we have the middle air, and then we have this inner air. Today we'll be talking about this part, the external air. Okay, so here's another diagram with a much clearer illustration of the external air, the middle air, and the inner air. So the first part that we'll be covering of external air is the pinna, the auricle. The most important part about the auricle that you should know is that when we pull the auricle backwards or in any position, it recoils back to its original state. Now this is due to a very special reason. This auricle consists of something called the elastic cartilage. Because of that, it's able to recoil back to its original position. Now the elastic cartilage is not present a lot in our body. The other place where it's present is the epiglottis. Now the other thing you should know about pinna is that it's got two surfaces. This surface that we're seeing, it's the lateral surface. Here it's the helix, the tragus and the antitragus. It's got a lot of landmarks. Here we have the medial surface, that is, if you turn your ear around and look at the back, this is the medial surface of the pinna. It doesn't have much of features, it's mostly smooth. Now the importance of knowing the surfaces of pinna is that you should know the innervation of the different surfaces of pinna. Now if you're looking at the lateral surface, this is kind of labeled diagram, it's kind of complex. I'm just going to put it in easier words for you. On the lateral surface, the lower 1/3 is supplied by the greater auricular nerve and the upper 2/3 is supplied by the auriculotemporal nerve which comes from the V3 of the trigeminal nerve, that is the mandibular division. Here on the medial surface, the lower one is supplied by the greater auricular nerve and the upper one is supplied by the flexor occipital nerve. Okay, after dealing with the pinna, now we come to the external auditory canal, also known as the external acoustic meatus. Okay, if we take a cross section of the external auditory canal, we'll see it's got two parts. The outer 1/3 cartilaginous part and the inner 2/3 bony part. Now, in the cartilaginous part, we should know the path that it takes and the structures in it. So, the cartilaginous part moves medially, then forward, that is coming out of the screen towards you, and then it moves upward. Medially, forward, and then upward. Now, once we done with the path, in the cartilaginous part, there are present hair follicles, which can become infected, and we call that furunculosis. Also, in this cartilaginous part, there are specialized apocrine glands called the ceruminous glands. They produce a very special substance called cerumen. What is cerumen? It's basically airwax. It serves as a mosquito repellent, it deterrs insects. Now, in the cartilaginous part, there is a pathology involved that we should know. Sometimes in this part, we get adhesions, which are called fissures of Santorini. Now, what do these adhesions do? These adhesions can serve as a site for exchange of infections and malignancy into the external auditory canal from the parotid gland and vice versa. That is, it can go both ways through these adhesions, which are called the fissures of Santorini. Now, after the cartilaginous part comes this outer 2/3, the body part. Unlike cartilaginous part, it does not have any hair follicles or anything of that sort. We're just going to do its path so that we know its path. It also moves medially, forward, that is towards you, and then it goes downwards. Now, in this part, the bony 2/3, we can also get adhesions, but this time they are called foramen of Hashke. But these adhesions are usually seen in children. Unlike the adhesions here, these adhesions are usually seen in children. Now, another thing about the external auditory canal that we should know is this part. This part which is called the isthmus. Now, why is this part important? This is the narrowest part of the external auditory canal. So, this has the highest risk of foreign particles being stuck here because it is the narrowest part. Now, where do we find the isthmus? So, the distance is like, this is the tympanic membrane, 4 millimeters, which is practically very small, 4 millimeters lateral from the tympanic membrane. We're going to find this, the narrowest part of the external auditory canal, the isthmus. Lastly, we'll talk about the innervation of the external auditory canal. The anterior part receives an innervation from the auriculotemporal branch of the trigeminal, which is coming from the mandibular ball, and the posterior part is getting innervation from the vagus nerve. Now, after we're done with the external auditory canal, we're going to talk about this thing here, the tympanic membrane. Okay, so this here is our tympanic membrane. Now, if you take a light and you put it through your ear through your pinna, it passes through the external auditory canal, and this is the structure that we're going to see. So I'm going to tell you the anatomical structures first, and then we're going to discuss them one by one. Firstly, here that we're seeing, this is the handle of malleus, which is an aerocecal malleus. These are the malleolar folds, the anterior malleolar fold, the posterior malleolar fold. Here, the center point is the umbo. This part is the pars flaccida, this is the pars tensa, and this is a cone of light. Now first I'm going to discuss this cone of light because it's kind of important from a pathological point of view, because in certain pathologies the position of this cone of light can change depending upon pathologies. Now another thing that we have to talk about the tympanic membrane is that it's imaginarily it's divided into 4 quadrants. One vertical line and one horizontal line divides it into 4 quadrants. Okay, so it'll be better if I show it to you through a drawing. Okay, so I'm gonna try and draw a tympanic membrane here for you guys. So first let me draw the handle of malleus, then the umbo. Let's just draw a tympanic membrane, or you can say it's a cross section, not a true anatomical diagram, I'd say. Here we have the malleolar folds where it goes down. This part is the pars flaccida. This here is the pars tensa. Let's like color it blue maybe. Okay. I don't know when was the last time I used this eye. Okay, so this is the pars tensa. Here we have the pars flaccida, and these are the malleolar folds coming from the pars flaccida. Now the thing is how it's being divided. It's being divided by a vertical line which passes through the handle of malleus like this, and a horizontal line that's going to pass through the umbo. So this is divided into 4 quadrants, 1, 2, 3, 4. Okay, this is the anterior one. Okay, let me write it here. And this is the posterior quadrant. Okay, so this is the anterosuperior, the anteroinferior, the posterior-superior, and the posterior-inferior. And usually we have the cone of light somewhere around here in the anteroinferior quadrant. So if it moves into some other quadrant, we can think that there is some pathology involved in it. Also, since we're at the diagram, so I'm going to show you that here at the malleus there is a muscle attached at its end, the tensor tympani muscle. We're going to look at it later, but just mentioning it here. This is the tensor tympani muscle. It kind of tenses up the tympanic membrane so that less vibrations pass through. Okay, so back at this diagram, we've covered the anatomical points and the imaginary planes that the tympanic membrane is divided into. So now we're just going to go through some important features of the anatomical points. Firstly, the pars flaccida that we have here. This is the part of the tympanic membrane that gets ruptured when you're cleaning your ear really vigorously. We've heard our elders tell us not to clean our ear, not to go too further inside the ear. It's because we can rupture this thing here. Now what? This thing is really loose. It's got the areolar type of the connective tissue. It's really loose. Now the pars tensa here, it's sort of a thick membrane. It's got the dense connective tissue. Now we're going to look at the histology a little bit. It's got 3 layers. If we look here, it's got 3 layers. Okay, just ignore the lines, I'm bad at it. It's got three layers. Now, this is the first layer, the epithelial layer, which is made up of ectoderm. Its epithelium is continuous with the epithelium of the external auditory canal. Then it's got a second layer, the fibrous layer, which is made up of mesoderm. Now, this fibrous layer is absent in pars flaccida. This is the difference between flaccida and tensor. The fibrous layer is absent. And the innermost layer is the mucosa. Now, why is it important that we know these layers? Well, because if we have damage to the tympanic membrane, let's say we have a central perforation. Now, if we have a central perforation, first you should know what a central perforation is. A central perforation is one which is surrounded by the entire tympanic membrane. Now, if you have a central perforation, when this perforation is going to heal, you're going to see something interesting. Now, what's that? You're only going to have two layers here instead of three. Why is that? Because the fibrous layer, it takes longer time to heal and appear again. So in that time, the epithelial layer seals this injury off. The epithelial layer seals this part off. Thus, we do not have a fibrous layer. That's only two layers present here. Thus, we can distinguish normal from the abnormal knowing this basic knowledge. Okay, so we covered the anatomy, we covered its arrangement. Okay, just simple points from the book that it's pearly white in color, the tympanic membrane, and it's oval in shape. Okay, thank you for watching, guys, and this was just an overview. Go through your books, and if you have any questions, ask in the comments, and if I made any mistake, kindly let me know so that I can correct it.